Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to treat chikungunya virus symptoms. Chikungunya is a virus, chikv, spread by bites from infected mosquitoes. Outbreaks have occurred in most areas of the world, including the Americas, Asia, Africa, Europe, and islands in the Indian and Pacific Oceans. There have been no reported cases of locally acquired chikungunya in the United States or its territories since 2019. /r/n/r/n fever and joint pain are the most common symptoms of chikungunya. Other symptoms may include muscle pain, joint swelling, headache, or rash. Currently, there are no medications to treat chikungunya. The best protection against chikungunya is to take measures to prevent mosquito bites. A vaccine is available in the United States. /r/n/r/nsachai_r. Getty Images /r/n/r/n Chikungunya was first identified in 1952 in the United Republic of Tanzania and subsequently in other countries in Africa and Asia. The first recorded urban outbreaks were in Thailand in 1967 and India in the 1970s. Since 2004, there have been more widespread and frequent outbreaks. Chikungunya has been identified in 110 countries in Europe, Africa, Asia, and the Americas. /r/n/r/n Chikungunya circulates in tropical and subtropical regions. The name chikungunya comes from a word in the Kimakon language, spoken in parts of Tanzania, meaning to become contorted. It alludes to the stooped appearance caused by joint pain. /r/n/r/n Between 2006 and 2013, an average of 28 people per year in the United States tested positive for recent chikungunya virus infection. All of them were people visiting or returning to the United States from affected areas in Asia, Africa, or the Indian Ocean. Chikungunya was rarely identified in U.S. travelers before 2006. /r/n/r/n In 2013, Caribbean countries and territories were identified as the sites of the first local transmission, spread through infected mosquitoes in that area, in the Americas. /r/n/r/n Chikungunya was reported among U.S. travelers returning from affected areas in the Americas in 2014. Local transmission was identified in Florida, Texas, Puerto Rico, and the U.S. Virgin Islands. Since 2019, no locally acquired chikungunya cases have been reported from U.S. states or territories. /r/n/r/n The U.S. Food and Drug Administration, FDA, licensed a vaccine for the chikungunya virus for adults aged 18 years and older in November 2023. Data on the vaccine is being evaluated to determine recommendations for who should receive it, such as those traveling abroad, laboratory workers working with the virus, or people in the United States who have or are at risk of transmitting the virus. /r/n/r/n The chikungunya virus is part of a group of viruses called alphaviruses. This group includes viruses that cause similar diseases, such as the Mayaro and Ross River viruses. /r/n/r/n Mosquitoes transmit chikungunya, most common Aedes, Stegomyia, Egyptian Aedes, Stegomyia, albopictus, which can also transmit dengue and Zika viruses. These mosquitoes lay eggs in standing water. Both mosquito species feed outdoors, and Aedes, Stegomyia, Egypti also feeds indoors. /r/n/r/n Mosquitoes that spread chikungunya bite during the day and night. They are found in many countries worldwide, including nations in Africa, Asia, the Americas, and islands in the Indian and Pacific Oceans. /r/n/r/n Mosquitoes become infected with the virus by biting a person who is infected with the virus. The infected mosquito then transmits the virus by biting another person. /r/n/r/n The virus is not spread from person to person. It is bloodborne and not spread through coughing, sneezing, or touching. /r/n/r/n It may spread through contact with blood infected with the virus, such as through /r/n/r/n. Rarely the virus can be transmitted from a pregnant person to the fetus, particularly during the second trimester. The baby can also become infected at birth if the pregnant person is infected around the time of the delivery. This may result in severe disease in the baby. /r/n/r/n. There have been no reports of infants being infected through breastfeeding or chest feeding, and the virus has not been found in breast milk. /r/n/r/n. As of March 2024, the countries and territories with evidence of chikungunya virus transmission among humans within the last 5 years are /r/n/r/n Africa /r/n/r/n Asia /r/n/r/n the Americas /r/n/r/n. Most people who become infected with chikungunya experience some symptoms. Symptoms can appear between 2 and 12 days after being bitten and last 3 to 10 days. /r/n/r/n. The symptoms usually begin 3 to 7 days after a bite from an infected mosquito. Typically, people feel better within a week. /r/n/r/n. Chikungunya generally starts with an abrupt onset of fever, may be continuous or intermittent, frequently accompanied by severe joint pain that usually lasts a few days. For some, joint pain from chikungunya can become chronic and debilitating and may last for weeks, months, or years. /r/n/r/n. Other symptoms of chikungunya may include /r/n/r/n. Chikungunya can have mucocutaneous, typical skin and mucous membranes, involvement. These may include a rash that, /r/n/r/n. Chikungunya may also cause, /r/n/r/n. Treatment for chikungunya is symptom management. Currently, there are no medications to treat chikungunya. /r/n/r/n. Typically, chikungunya is self-limiting and doesn't require special treatment other than supportive measures. /r/n/r/n. Preventing mosquito bites is the best way to protect yourself and others from chikungunya. /r/n/r/n. Use Environmental Protection Agency, EPA registered insect repellents with one of these active ingredients: /r/n/r/n. Always follow directions. EPA registered insect repellents are proven safe and effective, even for those who are pregnant or breastfeeding, when used as directed. If also applying sunscreen, apply the sunscreen first, then insect repellent. /r/n/r/n. Do not use products containing oil of lemon eucalyptus, OLE, or paramethanediol, PMD, on children under 3 years old. Put insect repellent onto your hands and then apply it to your child's face. Avoid applying it on a child's hands, eyes, mouth, cuts, or irritated skin. /r/n/r/n. Other measures to take include /r/n/r/n. The chikungunya virus may be detected in the blood during the first week of illness using tests such as reverse transcriptase polymerase chain reaction, RT-PCR. /r/n/r/n. After the first week of infection, tests can be performed to detect antibody levels, the body's response to the chikungunya infection. Antibody levels are typically detectable by the first week after the beginning of the illness and can continue to be detected for about 2 months. /r/n/r/n. Because the chikungunya virus can be found in the blood during the first week of illness, it is important to prevent mosquito bites. If a mosquito bites you during this time, it can spread the virus to other people. /r/n/r/n. Research suggests that once you have had chikungunya, you are likely to be immune to future infections of the virus. /r/n/r/n. Most people make a full recovery from chikungunya, but occasionally, eye, heart, or neurological complications can occur. Chronic joint pain and chronic arthritis following a chikungunya infection can also occur and may be debilitating. /r/n/r/n. Those at risk for more severe disease include /r/n/r/n. Pain or swelling can occur in multiple joints with chikungunya, most commonly in the hands, feet, wrists, ankles, elbows, and/or knees. This joint pain can last past the initial illness, sometimes for several years. It may also go away after the initial illness and then come back 2 to 3 months later. /r/n/r/n People experiencing persistent joint pain, swelling, or inflammation should see a rheumatologist, a specialist in inflammatory and joint diseases, for an assessment and treatment options. /r/n/r/n To help ease symptoms while you recover from chikungunya, you can try measures such as /r/n/r/n Do not take aspirin or other non-steroidal anti-inflammatory drugs, NSAIDs, such as Advil/Motrine, ibuprofen, or Aleve naproxen, before dengue fever has been ruled out as a cause of your symptoms, to reduce the risk of bleeding. /r/n/r/n Chikungunya is a virus spread by infected mosquitoes. The most common symptoms are fever and joint pain, but other symptoms, such as rash, may be present. /r/n/r/n For most people, the illness lasts about a week, and then there is a full recovery. In some cases, joint pain can become long-lasting, chronic, and debilitating. Complications occasionally arise. Newborns, older adults, and people with pre-existing conditions are most at risk for severe illness. /r/n/r/n Chikungunya is typically self-limiting and resolves without treatment. Treatment for chikungunya involves symptom relief, such as rest, fluids, and Tylenol for fever and pain. /r/n/r/n It is important to take measures, such as insect repellent and mosquito nets, to prevent mosquito bites if you are in affected areas and, if you have a chikungunya infection, to prevent spreading it to others via mosquito bites. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.